Check. 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 次 check 次。
Good morning, ladies and gentlemen. Good morning. How you all doing? A big welcome to all our innovators. Don't worry, it's quite cold, I know, but they're going to regulate this temperature. We'll have them regulated so that we don't freeze out before we start out. All right. So this session is the pre-pitch session, right? It's originally. Can we turn the music off, please? Off, please. Thank you. So originally it was supposed to be a completely closed door session, right? But then we thought it was important to just open it up a little bit, and otherwise, so that more people can also see and learn. There are people joining us online presently who are viewing, and then a number of other persons will come in. But we don't want to waste time. It's an early morning session. This is supposed to just prep you towards the proper pitch that's going to happen later in the day, right? I'm sure you're aware of that. Okay, so this is where you put your best foot forward, and you ensure that you put in your best and learn and get a lot of feedback. With feedback, then later in the day, you are able to also do your pitches. So Femi Obedare is my name, and I'm Senior Program Officer with the Policy Innovation Center, the mother organization of the Behavioral Innovation Lab that has been engaging you. That we're working together on this. And right here with me is my colleague, Nia Adekanla. He's also going to come up very shortly. And we have here as well our speakers, our coaches for this innovation session. And when I come back, I'm going to introduce them properly to all of us. All right, it's my colleague, Nia, to come and set a context very quickly. And then when I return, I will introduce our coaches, and I'll give us the detail on how this session will run. Thank you very much. Good morning.
All right, good morning, everyone. It's such a pleasure to see this day. To start with, my name is Nia Adekanla. I am a senior behavioral economist within the Policy Innovation Center, and specifically within the Behavioral Innovation Lab. I want to say this to start with, just to set the context. This is not yet another rehearsal. It's a time to refine our brilliance or the brilliant ideas we have. It's a time not to judge you, but to improve what you want to put to the table. I want to assure you that to have come this far, it's been a journey indeed. Maybe you've not known, we had about nothing less than 400 pitches submitted. Innovation, different forms of innovation submitted, and I must tell you, they were quite exciting enough. And I must tell you, for you to be here today, it's not an accident. So I want you to put your best feet forward, and please, I want you to take the feedback with all sense of responsibility to be able to do the best when you get to the real stage. This is not a rehearsal like I mentioned. Please, I am so confident that we have judges do justice to this, and I want you to learn from them. They are coaches. That's what we call them. They are coaches, and I believe they are going to do best to this. So, I want to hand over the baton now by judges, and of course, as out, just present, and of course, you get a feedback. Thank you so much.
It's quite cold, but we can make the applause warm. So please. Thank you very much. Also with him is Mr. Segun Shogoawa. Please, Segun, for me and for us. Mr. Segun came all the way from Sudan to be a part of the summit. Somebody say, wow. So please don't waste flight money. I beg you. All right? Good. So we go straight to the pitch. We don't have much time. And here is the flow. Please pay attention. If you are pitching, I believe you have your presentations shared already, right? Tifad, are they queued? But I can start on. All right. Am I going in order of what we have on this list, the order of this list? So please come. I need to know the order we're going at. So I need to know who is going first and next and last, and then we can get it. But here is the flow. You've got 3 minutes to do your pitch or to make your pitch. All right? You make your pitch in 3 minutes. Once you make your pitch in 3 minutes, you get feedback for another 3 minutes from the coaches, and then we'll move on to the next, to the next, to the next. Bear it in mind, this is preparing you, okay? because the real deal in the afternoon will present you to the larger audience. Now, before we start the very first one, while I wait for Tiva to get back to me, I would like to hear from our coaches who are seasoned innovators, and what they're going to say in 1 or 2 minutes will be helpful to all of us. So I'm going to put a question out to, yes, in 1 minute it will be helpful to all of us. I want to put a question out to our coaches. Can I have a microphone quickly? Let's start with Moawa this morning. The same question will go to Dr. Akinyoke. So, sir, can you just, for the benefit of all of us who are listening this morning and who are aspiring to be better innovators, can you tell us in 1 minute what you've observed as the most critical challenge for innovators in taking their ideas from that concept to product, to service, and to a fully profitable idea, that goes to market?
Great, thank you.
Thank you, sir.
And it's a pleasure to be here. And I'm going to speak from my experience of also having to do a pitch and do an innovation much earlier when innovation started to be a big thing here in Nigeria. It was around health. You always have your idea. You think you know your market. I think it's very important to understand how your beneficiaries are going to interact with your product. So always tell people as technical people, you tend to design from what you think people need. But it's very important to understand what your market needs. How will they interact with your product? Will it be of benefit? Now, that is one part, that's the market. You also need to think of your investor. Why would your investor want to put any form of resources into your product? So you can see the stakeholders, all the people who are going to interact with your product are very, very critical. So know your market and understand how your investor would want to invest and why this is going to be important to them. Thank you.
Fantastic. Hello? All right, fantastic. So market knowledge is very critical, and what is in it for the investor, very important. Yeah, thank you so much for that, for the profound inputs there. Doctor?
All right, to add on top of those very important points, because when you talk about innovation and adding value to your investor, at the end of the day, how does that also improve or impact the wider context within which you are innovating? The basic definition will tell you innovation should make things better. So at the end of the day, yes, it's good, the market now, you remove some friction, the investor gets some value for their investment, but what about the social impact of it? How does it make life really more meaningful than before the innovation?
Wow, fantastic. Thank you so much for that too. We can have the mic back from him so we're easy to go. Okay, again, please, if you're not pitching, the second row is reserved only for the innovators. Kindly move to another state so that we have a clear distinction. So without further ado, we're going to go straight on to the pitches. Again, don't forget, you've got 3 minutes. Your time will start counting once you get off stage. And then the other 3 minutes will be feedback from the coaches. So I'm going to call up straight up right away a gentleman here, Abib Olawale Akinshola, Innovation Abiyamo. Please, a round of applause for Abib. Please, a round of applause, everyone. A round of applause, everyone, for Abib. Thank you very much. Flo.
Good morning, distinguished guests and judges. So, I'm going to start by asking, how many of us here just welcomed a newborn or know someone that has a newborn baby? Okay. So, these babies, every moment spent with them feels special, right? Like, aside from when they are crying, every time they move, every time you spend together, it feels like a very precious moment. Now, let me ask, who knows how long it takes to bath a newborn, the way we do it in Nigeria? That massage you do and the stretching of their arms and legs and everything. I would say 15 to 20 minutes. So, do you know, every 3 minutes, next slide. Every 3 minutes, the term infants die. So within that 15 to 20 minutes it takes to bathe a newborn in Nigeria, 25 to 34 preterm babies, newborn preterm babies have lost their lives, with majority occurring across sub-Saharan Africa. And this is not because of lack of love or lack of medical knowledge or the lack of the technical I'm sorry. Can I go again? I'm a bit cold. Okay. So this is not due to a lack of love or the. Sorry, please, can I start again? No, because I've lost my flow actually. Okay. Okay, sir. Okay. So let me start from the beginning. So like I said, aside from when they are crying, every moment spent with a newborn feels special. And it takes approximately 15 to 20 minutes to bath a newborn the Nigerian way, but including massaging them, stretching their arms and everything. But every 3 minutes, 5 preterm infants die. So within that 15 to 20 minutes to bath them, approximately 25 to 30 preterm infants have lost their lives, with majority occurring across sub-Saharan Africa. This is not due to lack of love or lack of medical. Sorry. Okay. This is not due to lack of love or lack of the medical know-how, but this is an infrastructure failure due to the lack of reliable electricity, which turns traditional incubators to expensive coffins. I'm Habib Akinshola, founder of Apex Health. And while studying biomedical engineering, this crisis drove me to work on a solar-powered infant incubator as my final year project. Next slide. So meet Abiamo, a solar-powered infant incubator that is designed to deliver ICU-level care to newborns in rural communities by delivering constant power. It has an intuitive user interface and is locally manufactured. The name Abiamo comes from the word, which simply means the one who gives birth, but is usually used to describe a loving, caring, and capable mother. Next slide. So, with 8.7 million preterm births occurring across sub-Saharan Africa and Southern Asia, and 3.8 million occurring in sub-Saharan Africa, our target market is massive, and our target customers are hospitals and NGOs, rural hospitals, government health programs, and private clinics. Next slide. So our business model is primarily hardware sales through unit sales and components. Then services like training programs and maintenance services. Plan to also have strategic partnerships with government and NGO bulk. Next slide. So our goal is to save 2,800 infant lives by our third year of operation, providing rural mothers with high care and maternal empowerment. Because when mothers are bothered about their newborns, they will be able to go and contribute to the economy of the country. Next slide. So our team combines biomedical engineering experience, CAD modeling capabilities, and geoinformatics proficiency to provide the Abiamo solution to those that need it the most. Next slide. The ask is $100,000 over the next 4 years to help us complete certifications and begin pilot deployment and construction on our facility. And we're also asking for regulatory support through NAFDAC and State Health Ministry, validation, and market access through introduction to state health commissioners and international NGOs. Now, the question isn't if this is possible. The question is who is going to join us to create a future where the 5 preterm infants that were lost in the 3 minutes of this pitch are installed in their Abiamo incubators, receiving the warmth and care they need. The future is reliable power supply. The future is Abiamo. Thank you.
All right, please stand. You don't have to go. You'll get feedback immediately from, so right on stage here. Just over here. No. You stand behind the podium. Yes, behind the podium. Right. Good. So can we have the microphones to the coaches rapidly, and let's have their feedbacks one
Great.
after the other promptly. Thank you.
Thank you very much. Please, could we just appreciate him once more? Thank you. So we are not judges. We are here to coach you to make sure you have a very strong pitch. I like your use of data. That was fantastic. Very great. I also like the name of your product, Abiyamo. I would love if you stress it more because you know your audience know what Abiyamo means. It came back much later. You could see your confidence flawed when you started. The intro is important. Why don't you go with the intro you are strong at? Introduce yourself. Build your confidence. Talk about Abiyamo and why. Then you can now go to the problem statement. Appeal is very, very important in products. You think your market is government. You see that nations. I thought you'd be appealing to that mother, to the people who have kids. That's the important thing because they want their kids to survive. So you want to stress that. If you appeal to them, then it's easy to now say, this is why my project decided I want to strengthen that survival rate of that kid. Your kid, the future mother. That's the appeal. Because then, as an investor, my antenna is going up to say, okay, you have something. Because he's also looking to say, else is very interested in what you're talking about. You are the technical person. We call it the course of knowledge. As technical people, you focus on technical. Appeal to the audience. Sell Abiyamo. Because everybody is aspiring to have a kid and they want their kids to survive. I like the back end in terms of the people who you would support you in your journey, the regulatory process. I think that is also very important. But you're in a crowded space. So it's very, very important for you to say, what is your distinct offer? Stress your value position. Because the people you are talking to already have seen a lot of other products. Why is Abiyamo unique? What's your unique sell? Remember, be yourself. Start with that intro. Build your confidence and tell them why this is the most unique product and why it's going to go a long way and why you want to carry them in this journey. And with a little bit of 100,000. Make sure it is not the money.
Thank you so much, sir. Thank you so much, sir. Right.
Thank you. It's okay to clap.
Yes, please, by all means.
All right, so I'll be very brief. Most of what I also thought important had been shared, so I won't repeat to save time. And I'll also go back to that intro. I think the preterm deaths is very critical that you identify that. And in terms of creating defining that solution and creating the for us to want to get involved with it, I think creating that story. You started story, right? Frame that story, frame your story into that story, and it will become more powerful. I think one other thing that I'll just mention is your slides, I think you had 5 or 6. Now we need to get them to 5. Right?
Yeah.
I think that's what the rule is. In terms of, there was something. The clarity of the slides, I think they speak well to what you're trying to tell us. I like the picture of the prototype, and that's something to commend. I would like you to also maybe invest some time in connecting the impact and relevance of this. This is a big deal. You can bring out that story more powerful with some numbers that speak to. So at the end, I think you mentioned 2,800 children you want to save. Give us the context in terms of what's the current preterm death numbers. And then when you match it, it will give us some, a wow feeling about, wow, this is a big deal. And all of these critical stakeholders can then tune their antenna and want to support you. So thank you very much.
Thank you so much, sir. Round of applause. Akeem, as you take your seats. Yes. All right. So again, don't forget, now that's the more like the warm-up All right? So every other person, I'm going to be quite strict with time. 3 minutes, and they will get on. I will invite up stage Theophilus Venn. A round of applause, please. Everyone, round of applause, please. Everyone. If you're not clapping, you shouldn't be in this room. Very quickly, Theophilus, you have the floor, and your time actually starts now. Thank you.
Good morning, ladies and gentlemen, distinguished judges. Imagine a product that nourishes the body and protects the environment all at the same time. Next slide. My name is Theophilus Venn, and I am the founder of Vent Ventures. Produce Venn biscuits. It's made from fresh tropical fruits such as ginger, carrots, dates, and even coconuts. Our aim is to fortify food with essential vitamins, particularly to improve the quality of life for women, children, and those in underserved communities. We didn't just stop there. We produce a biscuit crafted into a cup known as the edible cup, suitable for your creams, drinks, and yogurts. In fact, when you finish your drink, you can eat your cup. Our mission is to improve nutrition, reduce plastic pollution, and post-harvest losses. The world faces a challenge today. Many mothers are responsible for feeding their families, while children suffer diet-related illnesses and diseases. Malnutrition in Nigeria, according to UNICEF, about 2.9 million children suffer malnutrition. In addition to that, post-harvest losses as a result of poor storage, poor distribution channels has affected many local farmers, most especially women in our communities. Now, 2.5 million tons of plastics are generated yearly. Less than 15% in Nigeria are recycled. Children have to wade through flooded waters just to get to school, to learn. And sometimes, most times, plastic pollutions, such as plastic cups, are the major cause of pollution. What is our solution? Our solution is a product that nourishes the body and protects the environment with 40 fresh tropical fruits. The market is enormously large, and the biscuit market is also large. We are targeting men, children, and those in underserved communities, sustainability-minded people. We are a B2B business, hotels, schools, restaurants, and we use digital technology, such as our website, social media marketing, and a QR code where we teach nutrition education in secondary schools. This is our impact. About 1,000 units has already been sold during our market testing. 5 times return, eco-friendly product, even the products from our process, like the coconut for coconut shell buttons. That is what Mrs. Babatunde has styled my coat with. These are coconut shell buttons. Education, access to nutrition education. All the teachers need to do is scan a QR code, and it takes them downloaded material on education and climate change. I am a pharmacist with over 5 years of experience, and I have a medical doctor on our team also. We are asking for 10 million naira in order to improve process, equipment, and also digitalize our toolkits in various languages, Igbo, Hausa, and Yoruba, and also get a marketing. These are our recognition so far in the last 8 months. Thank you very much.
Thank you so much. A round of applause, one round of applause for Theophilus, rather. Thank you so much for this.
Thank you, Theophilus. This is really good. I would like to eat my cup. That is what you should pitch with.
Brilliant.
It's sticky, so stick with that. I see you're also going women and children. It's very, very important to be very, very sharp about it. What you do and what you have is you already have a product. It's now how does this product and who is it going to appeal to the most? Like I said, you are going into a crowded space. But what is your distinct offer and why? There is a lot of school feeding programs where there is an emphasis on kids having, nutrition in a pack, and you already have your nutrition in a pack. But think of something young people can eat their cup at the same time, contributing to knowledge of reducing waste and also contributing to, sustainable products over time. I think you're going to have a fantastic product. I've seen your pitch and your ask. I think you should also ask, or maybe there's room for you to see how you are going to market it. There is always that need to focus on technology. But you see, your market is low tech. So it is very, in low tech, you are going to have to use edutainment. And that's why you see me say, eat your cup. Example, Indomie noodles. What about Indomie noodles when you see the adverts? Singing. All the best.
Thank you so much, sir. Round of applause. Round of applause.
Thank you very much. And again, in fact, that was the first thing I wrote down. Eat your cup. It's a punchline. It's a powerful punchline. You can spin it in multiple ways. Just to add to everything else that's been said, you have a fantastic product. The fact that we can feel and touch it, I love it when it comes to innovation. Okay. But I'll ask you to ask yourself a question. What will you lead with in terms of all these three great things? You've got three verticals. You've got nutrition, you're dealing with malnutrition, you are talking post-harvest losses, you're talking plastic pollution. I would ask you to reflect, and what exactly will you lead with so that it makes your pitch more powerful and more punchy. So that's homework, sorry. But in terms of the positioning, yes, you have already identified a very good market to place yourself. But I just believe that once you have a clarity in terms of which one you want to lead with, it will help you to also target your market a little bit more. Your slides are, I think they are 5, good, within tolerance. The intro, tighten it a bit. Yeah. And I think it's because you have those three verticals. Yeah. So try and check that. But fantastic.
Thank you so much, sir. A round of applause for, please, yes. You may have your seat. Thank you so much. Next on the line, Emmanuel Ejike. Can you take the floor, please? A round of applause, Emmanuel. Please, can we give a round of applause to Emmanuel as he comes off stage? Thank you. Thank you. Emmanuel, please step up. Your time starts the moment I see you on stage. All right. Great. So your time starts now, Emmanuel.
My name is Emmanuel. Good morning, everyone. My name is Emmanuel, and I'm the founder and CEO of Hemolife is an AI-driven P2P blood donation application. So back then, I've lost 2 siblings, 2 sisters as a result of blood transfusion-related issues. And so I've been a regular blood donor for the past 7 years. So back then, in 2023, I got a fully funded scholarship to study masters in a reputable US university. So, and sorry, the code is a reputable US university. So I went to the National Blood Service Agency to donate what I believe to be my last blood donation before I japa. So, and the problems that existed, like the of business life, the number of deaths that occur as a result of lack of blood availability in Nigeria. Nigeria needs about 2.3 million annually, and only 10% of these are voluntary blood donors. We simply, all this goes to show that we simply cannot meet up with blood needs. People die daily because of lack of, blood in Nigeria. About 200,000 deaths annually in Nigeria. So next slide. So I went back after that, expose to discuss with a friend who was a guru in software and app development. That was how Hemolife was born. So these are we knew that there was a need encourage people, especially the medically eligible youths, to constantly, you need to speak their language. So we had to make, AI-driven, real-time donor recipient proximity matching system, because one of the issues was that a lot of hospitals do not have blood banks. So, but humans are walking blood banks, naturally in your body. So we had to devise a way to make humans to meet each other on demand through the peer-to-peer donation system, introducing AI health assistance for guidance. Just you introduce the fund into the entire donation process. Please, next slide. So this is a market opportunity. Almost everyone in Nigeria have blood running in their veins, and then an addressable market of $10 billion with opportunity global that exist. All hospitals, blood banks themselves, which need to get the blood to people that need and products like here. Next slide. Yeah. So because we want to address the problem first, we are starting with the freemium model. So we don't want to charge people that are in need of blood, because it's like drawing blood from them actually. So from there, we now enter the premium features when we have some of these offerings, payment solutions, and even commercial donors that could get something, because you can't want to take from people without offering them something. So next slide. So these are impacts so far. We've onboarded already 300 hospitals already, and our app is live. You can scan me to download our app, but we are making a public announcement on the 8th of September. Please, next slide. So this is a power tip. Thank you very much.
Please, you can stand over, sir. Over there. Stand to my left, please. No, to my left on stage. Please, a round of applause. Please, take the stage. Take the center of the stage. Yeah, all right. Thank you so much. Have our feedback quickly from the coaches.
Okay, great. Thank you. And thank you for sharing with us. I think you have a very fantastic product, but your delivery is very important. I always tell you, you are pitching, you are engaging an audience. Your slides, not the story. Don't focus on your slides. Focus on the audience and tell us why. I think you didn't bring out the unique thing. You've gone beyond ideation. You have a product. What you should be giving us in terms of data is, this is already in use. These are the number of people using it. This is why they like it. So with your support, this is where we can go. So because as an investor, what I would like to see now, okay, you have 300 hospitals. Oh, okay, fantastic. So why did they like it? Because I want to now, because right now you are scared. No, it's not about explanation, because you've put it in your slides that you've onboarded. So your app has gone past a particular stage. It's not, are you prototyping? Is that what you're saying? It is fine, but remember we are pitching to me. You've given me some background information that is interesting to me. It's not your launch that is the important thing to do. If you've put it on Play Store and everything, it means you are already testing. You are having some people downloading. That is what the data you should be presenting. You've gone past a stage. Your public launch is saying, when we launch, it's going to triple or quadruple. As an investor, that is where I want to put. Because I'm looking at where it's going to be very, very important. If I put it here, it's going to happen over time. So it is very, very important for you to be able to pitch that. Don't be a technical person. Pitch to us. Your audience is the most important. Don't fixate on your slides. You have a product. It's already at this stage. This is what we've done when we put it on this. This is part of the feedback. We've addressed some of the chinks. With our support, this is what is going to happen. And this is our unique sell. So you did the technical thing. Don't ever focus on technical. We don't like technical jargons in this world.
Right.
Blood is very important. It's a blood bank. So what you are saying is you can enhance the process of donations and getting blood to the right people.
Yeah, very critical.
We want it, keep it, remember something about it. We've all had AI for like forever, so we don't want you to dwell on the tech. Pitch the product. to us and the value of the product and where it is at that moment. You can say I fixated on something.
Thank you so much, sir. Doctor?
So, and I'm going to share this with everyone who is pitching. There's something they call the art of rhetoric. There are 3 elements to it: pathos, ethos, logos. That pathos part, I think, what my colleague was trying to emphasize on. How do you engage the audience? You've got a full solution to one of the biggest challenges that our country has, right? But I'll ask you to tap deeper into that personal story, because that is where you hook us primarily, and then we want to hear everything else, right? As an investor, I'll also be asking now, once this, and you have access to all of this data, what are the data protection systems you've got in place so that we don't run foul of the law, right? Because you're going to be gathering a lot of data. You're going to be matching blockchain and all of that. So that should also be gives comfort to the investors, the audience, to say, okay, we can bank on this and we can be sure that we will be fine. I'm just trying to layer on top of everything else so that I don't repeat what's been said. There are key things you said that I would love that if you can hone in on them. Things around walking blood bank. Those are things that, you know, they are very catchy phrases that will stay with us in your audience.
True.
Identify those, hammer them. Thank you.
Thank you so much, sir. A round of applause again, please, everyone. Please, you may take your seat, Emmanuel. Next on the line is Mutunrayo. Mutunrayo, please. A round of applause for Mutunrayo to take the stage, please. Thank you so much, everyone. Mutunrayo, time starts now.
Good morning, distinguished guests. My name is Mutunrayo Sonyalu. I have an aunt. My mother told me this story. She was married for so long without being able to conceive a child. But then after 7 long years, she finally had a child. But then somewhere along the line, she had some complications, and she had to give birth to this child prematurely. So, sent to the ICU in the hospital, and I kept in an incubator for a very long time. Then after a while, the mother became very weary. First off, the cost of using an incubator was already piling up, becoming overbearing for the family. Then secondly, this is someone that has wanted a child for so long, so she wanted to keep to hold the child. So with the agreements of the with the doctors in the hospital, they decided to take the child home. And they did, but days later, tragedy struck in the household. She went to check on the baby and she touched it. She realized the child was cold to the touch. So they moved quickly, they rushed the child to the hospital. And this is something that, in a matter of minutes, the situation escalated so much that by the time they got to the hospital, the child was gone. Until now, she still doesn't have a child. Unfortunately, this is not a unique story. It's not an uncommon story in Nigeria, because we happen to rank first when it comes to preterm neonatal mortality index. And then the biggest contribution to this is hypothermia, cold. That's when the baby's body temperature drops too low. Then we spoke to a doctor, and we realized that there are 2 main factors that contribute majorly to this. First is the fact that families cannot really bear the cost of using incubators over time. Then the other one is that smaller hospitals can't even afford these incubators in the first place because they are so expensive. So our solution is something that addresses these 2 major complaints, because it provides heat to premature babies, because it is because it's not reliant on NEPA power, because it uses rechargeable batteries, and because it is portable and can be used for transportation. Because most of the issues happen when the babies are being transported from these smaller hospitals to bigger hospitals. They lose a lot of heat in that process. And by the time they get to the bigger hospital like Luth now, there's not really much they can do for them anymore. So our major consumers are going to be these smaller hospitals that cannot afford it, because incubators cost about $2,000 to $20,000, while ours comes as a modest cost of $60. And then we can, of course, not forget the families that have premature babies that will need this kind of product. So we're going to achieve this by going directly to the hospitals and selling directly to them, then by partnering with some NGOs and government organizations that can help distribute this product. Okay, so our major advantage here is that, first off, the materials that we're using for the products, they're all locally sourced. We got them from Nigeria, mostly in Lagos, actually. Then it's uses renewable energy. We understand the power landscape in Nigeria, so we can't really rely on that. So it is renewable powered. Okay, so what we're really trying to achieve here is to lower the rates of neonatal mortality in Nigeria, because these children are our future, and we're trying to secure the future of Nigeria. Next slide, please. Okay, this is our team. Our team is composed of some specialized engineers and also some external medical advisors and consultants. Next slide, please. So what we're really asking for here is a chance to see how we can develop healthcare in Nigeria. And we're asking for a modest cost of $40,000, or like 60 million in today's naira. This is going to power the cost of clinical trials, then also producing our first 500 units, then also facilitating connections and relationships with these organizations that are going to help us produce. Thank you very much.
Muturayo, thank you so much. Now to our coaches.
Great. Thank you very much. And I appreciate the work. I appreciate the story. But your story has taken almost 2 minutes of your time. So you need to find a way to bring out the point you want to say with the story very quickly, and then you can now focus on your product, which came much later. I was also looking at your data. I think there's something missing. I don't know what it is, but you may want to find the something missing. Again, you remember when I was giving just my thoughts about innovation, I always said, do you understand what else is in the market before you put something? You have a unique product, by the way. So your sell is a very important thing. You know, like a low-cost blanket to save lives. It's just something sticky we would all remember. We won't remember everything else, but let us remember a low-cost blanket, sustainable. Okay, that is sticky enough. And the market is also very important. Again, institutions are very difficult people to work with. You think they will buy your product. They won't, because there are a lot of I think he's the first person, and I think this is good feedback for everybody. He mentioned the regulatory bodies. They are very, very powerful, particularly in this sector. And if they don't have a buy-in, they're already an obstacle to anything. And as an investor, I don't want to get my money stuck in that bit. Now, also as an investor, I'm thinking, you're asking for $40,000, meaning you are still in ideation stage. Proof of concept is what you need to show me. Because you don't need to, it's feedback. So at this stage, if it is something low cost and you're asking for so little, meaning I should be seeing your proof of concept. That is it. And then, how is it resonating to the person? Why would people want to get it? Give me color. I mean, appeal to us. That's the big pitch. Because it's such a small amount of money. So I'm thinking, will it make the necessary? I'm just thinking, because I haven't seen how this is going to, okay, where will you produce it, for instance? How will you distribute it? And are you sure you have your target market right? Because, you see, you need to look at the class in society. The middle class can afford to do a lot. They can afford to put babies in incubators. They can, actually, for a long time. So, even though your story is talking about, probably she is in that income bracket, but you see the people who really need it are the so-called lower income people. That's the bottom of the pyramid market. That is where the market is. And it's not going to be the big hospitals who is going to get it for them. These are communities. So women groups who are interested in saving the children's lives of their, so you need to, just like you said, it's a nice name. I still think there's a lot of work to be done, but lead with where you are. A low-cost material to save lives in Nigeria. This is the data. This is what we feel can make the impact. You need to stick to the most important thing, because people and the judges will look at the things I have picked out in certain ways, and I don't want to ruin your confidence, but focus on the strength. You have a very good product, a very, very interesting one. You can see it's even different from the other person who was talking about new term things. So because now that you already know there's another health-related thing, focusing on children, what makes you distinct is what we want to see. Thank you.
Thank you so much, sir. Dr. Okay.
All right. Thank you. So you brought a product that appeals to my kind of innovation. So we call them frugal innovations. That's what they are. And like my colleague said, it's in identifying who needs this really. You know, at the heart of every innovation is understanding who is walking in the shoes of the person who is going to benefit from this. Okay. So a lot of what he said I agree with, and I will say just go now to your technical thing. The slides, I will just ask you to go over them a little bit more because there are a number of typos. You don't want to give that to an investor you ask him money from. Then think about who is the ideal investor for my product. Because in this product, there is value and it serves, look, most of us are all urbanized villagers. So those people are still there and we need to reach them with this kind of product. So just tweaking those kind of things will strengthen that unique selling point of this product. All right? Yeah. Neil Blanky. Thank you.
Thank you so much. Please, a warm round of applause for the coaches. I can't hear your applause, please. The temperature has dropped now. Or do you already know blankly? All right, a quick announcement to all of us. We need your feedback, so please take a moment to share your experience at this summit using any of the following options and stand a chance to win a gift. There's a QR code that will be displayed on the screen at some point. So we'd like you to please scan that when it is displayed so you can give your feedback. Or we have an usher who's going to share a code across board. You can scan that code and you can register your feedback for us. You can also use the digital screens at the foyer outside when we're done if you want to do that. Or use the research assistant's tablets just as you see them. The assistant is wearing a Gender and Inclusion Summit shirt. You can see her over there waving. Okay, so let's move on. We've got 2 more to go, and we can wrap up in the next 10 minutes or thereabouts. So please, upstage, I'd like Mr. Uche Kenneth Udekwe to step up. Please take center stage, and your time starts now.
Hello, everyone. My name is Kenneth Uche. I'm the co-founder of Smokeless Bricks Energy Solution, an eco-inclusive social enterprise that harnesses clean energy technologies to solve the problem of indoor air pollution, climate change, and energy poverty in Nigeria. Next slide. So 5 years ago, when I lost my dad, my family went into this financial struggle, and then my mom could no longer cook with gas. I mean, she had to start cooking with firewood. But anytime I tried to help her, she's either always coughing or complaining of chest pain. For God's sake, I just lost a dad. I wasn't ready to lose another member of the family. Next slide. But then I discovered that this was not just a personal problem. According to the World Health Organization, every year Nigeria loses around 98,000 women due to smoke-inhaled while cooking with firewood. It is now the 3rd highest killer after malaria and HIV. And kerosene usage is the leading cause of lung cancer and leukemia globally. Next slide. My question to everyone here is, must our mothers continue to sacrifice their lives just because they want to cook the food that we're going to eat? Of course, no way. Next slide. That's why we started Smokeless Bricks. And we produce eco-friendly smokeless briquettes from agricultural waste. Our briquettes are one of a kind. They last longer than every other charcoal out there, and they burn 2 times longer. More than that, they are way cheaper. And then for our solution, we've also developed an eco-friendly smokeless stove. This stove is built from recycled metals, and then more than that, they have a stainless steel burn chamber that reaches around 200 degrees in less than 10 minutes, giving 2 times faster cooking. And then what we've done is that we've incorporated our TEG technology, which converts the heat from the stove into around 30 watts of electricity, which can now be used to charge your mobile phone, produce light in the house, and also to read at night. And then we're working on our IoT technology to be able to track the carbon offset generated by our product and then earn carbon credits. Next slide. The market size is massive, $580 million with a 5.3% annual growth rate, and we're just targeting 25% of this market. Next slide. And then to ensure sustainability, we've developed a multiple revenue model. We make money by the sale. We make money by the sales of our briquettes and our stoves, and also we also partner with NGOs who are serving IDP camp, and we're also working on monetizing the carbon offsets generated from our products. Next slide. The impact of our solution is massive. Provides access to sustainable energy. It also reduces poisonous carbon, and then it increases the time that women spend picking firewood in the forest, and also help to reduce rural energy poverty. Next slide. The team is a compact team. Our founder has 6 years experience biomass production as well as RT technology. I'm a certified I'm a certified project manager, and then our CTO has a PhD in electrical electronics, and then we also have a sustainability manager. We're seeking for $100,000 to scale up production of our stove and briquettes, as well as R&D, marketing, and for our permanent working space. The goal is to
All right, to the coaches.
Thank you very much. This is very fantastic. It's fresh, it's unique, and it's addressing something that is very common in this context, which is very, very good. You used quite a lot of technical terms, and I think you already know the audience you are pitching to, which is investors. But the audience that would also support investors is, who is your market? You've spoken about your mom, but I didn't see the market. I always, and because I'm also, working on somebody who's looking at clean cook stoves, is, do we know how our parents cook? Do we know how people in the rural areas cook? That is very, very important. So what would substitute? Why would they want to use what you are bringing? It's good. You've appealed to the other techie things, carbon credits. All those things don't mean to them. They just want to cook for a household of 5, 6 people on time and move on. But you already have added benefit. Apart from the cooking, there's light, illumination, and those very important things. So that is very, very important as well. But I want to see that market very, very clearly and why they will be interested. And that's why a lot of people who do clean cook stoves fail. You fail to understand why the woman likes to cook with it beyond all the health benefits. Health is the least thing for the woman. She wants to cook for the household. It's the most important thing. That is a mother's priority. So you need to understand that very, very clearly. You can tell her all the benefits. If you cannot cook for 5 people on time, that is where you miss it. So you need to as you've gotten the investors with everything else, understand the people who are going to buy your products. I can see you have a location. That's a good start. And one thing I will tell you is that Nigeria is not homogeneous. Because it works in Ondo State doesn't mean that's how the woman in the north cooks. You need to understand the dynamics of how women in different parts of the country cook and why they will like your product. I even like the T-shirt I've seen because you've now mentioned that because that's what resonates with them. Charcoal. You've just made it in that. So that's it. That's the entry point, and you want to bring it out very clearly. I think your slides are too plenty. You need to look at where do you want to put people in everything? Like where do you want to situate us? Because you will run out of time in less than 2-3 minutes. You can see 3 minutes is a lot. It's a very short time. Yeah. I mean, you think, why is Femi disturbing me? But because really, you ran out of time. So put what you want to say front and center. I think you have a fantastic product. I can see your scale impact, but I still think you don't have a lot of money for marketing. You see, marketing is a very, very important thing because, how do I put it? If you read Malcolm Gladwell, and I think a lot of you should go and read Malcolm Gladwell, there's something called build it, they will come, where you think because I built a stadium, people are going to use it. You know the Abuja National Stadium. Who really uses it? It's fantastic. It's there. It is not the build it, they will come. Why do people go to the stadium? Thank you.
Thank you so much. A round of applause for our coach. The final feedback before we move to the last.
So, in my notes, I said behavior change/adoption. So, answering that question, just like you said, would strengthen this as a proposition for investment. Why would this be adopted? It's a brilliant solution, and there is an intersection that I see between health and environment. You are tying a story there. Tie that story well. Okay?
All right. Thank you so much, sir. A round of applause again for our coaches. And the final presentation this morning will be from Suleiman Habib. Is Suleiman online? Is ready? He's joining us online. Incidentally, he couldn't make it. He was to come from Kaduna. For some reason, he couldn't come around. So Suleiman online, can we connect? Suleiman, can you hear me? So we can do this very quickly in the next 3-4 minutes, and we are out.
Good morning, everyone. My name is Suleiman Habib.
Can we get feed from Suleiman, please? Thank you. Do we have any members of the BIN community here this morning? BI Network? You came from BI Network platform. Anyone? All right, thank you. Oh, well, I'll come to you. I'll come to you, folks. All right, Suleiman, good morning.
Yes. Good morning, sir.
Can you hear me loud and clear?
Yeah, I can hear you.
I wish you could
Good
hear him
morning.
louder than this. All right, Suleiman,
Yeah,
you have
Yeah, good morning.
good morning. Can we have a little more? Well, can you turn on your volume a little bit at your own end? Maybe your microphone needs to be louder. I'll come to you. All right, Suleiman.
Yeah, good morning.
Okay, this is fine. That's fine now.
My name is Suleiman Habib.
All right,
My
Suleiman.
name is Suleiman Habib, the founder
Suleiman.
and CEO
Suleiman.
of
Suleiman.
Free Farms.
Hello, Suleiman. Can you hear me?
Yeah, I can hear you.
All right, just hold on, right? Hold on. So you're going to start now. You have an audience here listening to you
Yeah,
and the
good
coaches, okay? So you've got 3 minutes
Yeah. My name is
to
Suleiman
pitch your
Habib.
idea,
My name is
and then you
Suleiman
get
Habib,
feedback.
Founder and CEO
Suleiman.
of
Suleiman.
Free Farms.
Hello, Suleiman. Can you hear me?
Yeah, I can hear you.
All right, just hold on, right? Where's the feedback coming from? So you're going to start now. You have an audience here listening to you. Okay, Suleiman, your time starts now. So you've got 3 minutes
All right.
to pitch your idea.
I'm the founder of Suleishat Poultry Farm. We are into the production of powdered egg yolk. Most people find it difficult to store fresh egg for a very long period of time because eggs tend to degrade, especially when the temperature, the weather temperature is very hot. Considering the high temperature here in the northern part of Nigeria and the lack of stable power electricity to refrigerate fresh eggs, eggs tend to spoil when kept for a long period of time. Secondly, most of the children are suffering from malnutrition, and yet they have not met up with the required nutrition intake as recommended by the World Health Organization. That is why we're bringing into the market powdered egg that will substitute fresh egg. This powdered egg can be kept for a long period of time, and it has a longer shelf life. Also, it contains 40 to 70% of the required nutritional value recommended by the World Health Organization for children. We have larger market as the population of Nigeria is increasing from 200 million. Most people are in their need of egg intake. As such, there is high market opportunity for us, and I'm very confident that our investors will have high return on investment when they invest in my product. Our impact, especially in the health sector, is we are causing malnutrition among children, and part of social impact is that we are ensuring food security. Yes, food security, because as eggs can be preserved, then we are preserving egg in powdered form. Then our economic impact is that we are generating jobs for the young population, especially women. We have 5 members in our team, and about 10 indirect employees that serve as marketers for our product. We are seeking for funding of $8,000 to scale up and acquire solar heat dryers, automated packaging machines, and packaging material to enhance our product. Thank you.
All right, let's give a round of applause to Suleiman. I mean, quite an effort there. Quite an effort there, given all the hitches. Can we just still have his face up there and then let's talk? Suleiman, please, can you hear me?
Thank you.
Suleiman, can you hear me, please?
Yes, I can hear you, sir.
All right, so you're going to get the feedback from the coaches very quickly. Please take notes. Thank you.
All right. Okay.
Thank you very much, Suleiman. Can you hear me? Just wave if you can hear. Okay, fantastic. Suleiman, thank you very much. For somebody who's very interested in eggs and nutrition, you got me. So I was very interested in what you had to say. I think you have a very good idea. It is very low tech. It's impactful for the community in which you want to serve. However, I didn't see your market, and I think this is very, very important. Because truth is, you shouldn't be talking about substituting fresh eggs for powdered. What you should be saying is that for those who do not have access to an egg, there are alternatives, and this is where your solution is going to come in. I don't know if you get it. The ideal with same WHO data is an egg a day, right? And it's fresh eggs. However, recognizing that in a context like our country, not everybody has access to that. We have brought this solution to make sure that others in hard-to-reach communities who are poor, urban poor and rural areas, have access to nutrition. It is very, very, very important. Nutrition is very important. And this is our product, and this is what it's going to serve. When I looked at the numbers regarding how much you needed, I also got a bit concerned because 8,000 is not going to pay your team. And you want to create jobs. Because it seems you fixated on just buying the material, and then what next after that? So are you saying you are giving the materials free to anybody who can afford $8,000 to get the same thing and then start making powdered eggs, and then you create job employment? Because as an investor, I want to be sure that I have something locked down, and if I put my money, it's going to lead to a multiplier effect where you earn something, we have our social impact, and me as well as the investor, we can now begin to say we are scaling across the country. So I think that is very, very important. But don't substitute fresh egg for powdered. What you are saying is that, and you started, you had a lead with it to say, for areas where you can't preserve or they can't get access, this is where our product is going to have the most value. So stress that and don't let people fixate, because as an investor, I want to be sure that I can see the whole thing. You didn't also communicate your value chain very clearly. But that is just feedback for you. Your slides were a bit very wordy.
Yep.
I didn't see, you mentioned some statistics, but I didn't see the kind of nuanced data that will help me. You will say, for instance, in Kaduna State, in Kano State, in Niger, that is the kind of thing we want to see. And I think this is general feedback for everybody, that your pitch and your presentation, you need to show the numbers localized. We're in a global world, so if you don't give me the big ones, give me you are the masters of your context. So show me that you have bothered to look down there and you understand where your product, who is going to get your product. So Suleiman, that is very, very important. Don't fixate on, I'll have a product, somebody is going to buy it. You need to tell me the person who needs the product. And you just mentioned it in person, but you didn't bring it out very, very clearly. The malnourished, school feeding programs. You understand your context. You are the expert in your context. And I'm sure if I asked you, you would know that one of the big indicators for keeping children in school is nutrition. Stress it. Thank you.
Thank you so much, sir. The final comment.
All right. Thank you very much, Suleiman. In terms of the problem you are trying to solve, we have some good idea. In terms of what your solution is, we have some good ideas. So thank you for wanting to give the children eggs. In terms of the impact and how relevant this is to our context, in terms of the malnutrition problem, yes. Now, I wrote down in my notes what's in it for me as an investor. You want $8,000. What stops me from saying in another 1 year the $8,000 is gone, maybe something happens, the machine is gone, you are coming back to another pitch like this for $8,000. You need to connect the dots for the investor. Give us a sneak peek as to how this 8,000 can become something. All right? And like they say, numbers don't lie. Try and strengthen this pitch with good numbers. And I believe that it will only enhance it and make it more enticing for your potential investor. Now, again, you want to qualify the investor and what's in it for them, not just the naira and kobo. How can they feel good about it, that they have invested with you? All right? I'll stop there. I think those are the substance of.
Right.
But overall, you have something we can connect with.
Thank you so much, sir. Please a big round of applause for all our coaches and all the innovators. Thank you, Suleiman, for taking time to join us. So we have come to the end of this particular session. We'd like to say a big thank you to everyone, the innovators they all came from outside Abuja, by the way. Yes, Sanyalu came from Lagos, Abi from Ogun, Emmanuel from Port Harcourt, no, from Jos, Uche came from Akure, and Suleiman is in Kaduna. Theophilus came from Benin. Please, a round of applause for all the innovators this morning. We encourage you all to wait. We're going to have, not here, join the hall, join the main session. Okay.
I just wanted to, sorry to interrupt you. So a few things. The reason why we organize this session is because you are going to be presenting to a very unique audience. I make bold to say that audience has a very rich opportunity. We don't want you to waste it, right? This session, if you go through the other, you see, by the way, this session is paid for, and you know what this means, for other breakout rooms. So I want you to see what has just happened here as very golden. You are not stopping now. If you need to excuse yourself from the main hall and go and rework this, please, that is the assignment you have between now and 2 p.m. when you have to present. It's a big deal, and I'm saying that unapologetically. It's a big deal. We don't want to see any presentation that is unvetted. All right, ma'am. We don't want to see any presentation that is unvetted. If you need help with any other post pre-pitch support, please, either Femi or Niyi, please, right? It is very, very important. And I really want you to sell yourself, just like esteemed coaches have said to us. Give it your best shot, because you don't know what will happen from here. As a matter of fact, we will be supporting you, in some level of, taking this work forward from where it is right now to the other. I'm not saying financially, we will discuss that later, but there's just a lot of opportunity, and I don't need to be selling the value of our own innovation lab to you right now, given what you have just seen. And you can see that we are pressed for time. That's why they couldn't give you the specific details, and what they have done is to coach and not judge. If I excluded myself because I'll be very critical and you'll feel judged. so it's good that we keep it that way. You're going to have a panel of judges, very astute, very renowned, very experienced in the afternoon. So please give this your best shot between now and afternoon. That is my final word for you. Please, can we help me celebrate Dr. Akin Oke and Mr. Segun Shongoa. Thank you so much. Please, see Niyi and Femi to help you, support you before this presentation in the afternoon. Thank you so much. And we are going to the main hall from here.